so let's go ahead and continue with our 9:06 a.m. item, which is an update on COVID from our schools. So Lake County Schools COVID-19 update. I'm so sorry, I just skipped public input. 9:05 a.m. Public input. Is there any public input on anything that is not on our agenda today? And seeing no hands in Zoom and nobody here in the boardroom, let's go ahead and close public input and open up item 6.2, Lake County Schools COVID-19 update. And with us, we have Superintendent Brock Falkenberg. Thank you for being here today. Would you like to take a seat?
Sure.
In front? That way, if people have questions for you, you can remain.
Well, good morning, and thank you very much for your time and the opportunity to share today. I walked into this and I felt very comfortable, and then I kind of took a look at the agenda, and now I'm really nervous because you've already gotten through all of your untimed items, and I see I have roughly an hour to fill. So I hope I'm entertaining enough.
We have a long expectation.
So I'm just going to jump in if that's okay.
Please.
Since March 16th of 2020, the superintendents of Lake County's 6 school districts and LCOE, as well as our leadership teams, have been meeting weekly to support each other through this COVID-19 pandemic. I should say at least weekly. Dr. Pace, Carolyn Holliday, and Denise Pomeroy have joined us for almost every one of those meetings. At least one of them have joined us for almost every one of those meetings. And I just want to make sure I recognize them and thank them for their leadership and their guidance as schools have navigated through this whole process. I also want to make sure I recognize Rob Young. Rob is the Lake County Office of Education Emergency Services Coordinator, amongst many other hats that he wears. And it is a position that I established 5 years ago, specifically to have someone that can focus on emergency crisis at those times when we need that focus, and we need that liaison between the schools and the operations center, and in this case, public health, so that we don't have all school districts and staff members reaching out directly to public health. We have a chain that they can work through the County Office of Education and try to alleviate some of the burden that comes with trying to serve 6 or 7 school districts in the county.
1 second, I'm sorry. That microphone is not working. So
We're gonna take a quick break, I guess.
we're there.
All set? Okay.
Just a quick fix.
So we've now reached this point where we are shifting, and I'm going to go back to the 2021 school year real briefly. Upper Lake School District, Lucerne School District, and the Lake County Office of Education offered in-person instruction through the entirety of the last school year. So while the LCOE programs are relatively small, I'm smiling at you. While the LCOE programs are relatively small, the other 2 school districts were able to successfully navigate through COVID in the 2021 school year. All school districts, including those that were open, had distance learning opportunities for any student who could not or should not be in a face-to-face setting. Beginning in April of 2021, the other school districts that were not in that face-to-face setting began to open up to open their classrooms back up to students, and had AB days, or days when only half the students would come in. And again, half the students was half of the students that were ready to return, so those numbers ended up being relatively small in some of our school districts. Our school districts need to be commended for several items, and I probably am going to miss some, but one of those is the fact that from day one of this pandemic, they have been offering meals to all children in Lake County and continue to do so. Our maintenance teams have taken the time to go through and upgrade and revamp our HVAC systems while students were out of the classrooms. And of course, our teachers and administrators were able to implement distance learning. And my wife is a teacher. She teaches at Mountain Vista in Kelseyville. And while she chose to return to the classroom each day for her instructional period, the distance learning really kind of was a change in dynamic. It opened up our household to all of those kids in her class, as well as their households to her. So in a traditional classroom setting, for example, students need help. And in a traditional school day, we would raise our hands and student or the teacher could respond. Well, in a distance learning model, text became that way to raise your hand. So texting became open and available 24/7. Now she limited it. She said, I'm done at 9 o'clock at night. But she was able to support students from 8 a.m. till 9 p.m. every night and worked diligently in that process. And while I'm singling her out, our teachers all worked diligently to implement a new instructional model, and that is distance learning. And there are things that we need to keep from that and learn from that and continue into the future. Now we find ourselves rolling into the 21-22 school year. And our schools are required to be fully open again. So on August 11th, Lakeport Unified, Upper Lake Unified, and Lucerne Elementary School District celebrated their first day of school, their back-to-school day. On August 16th, Middletown Unified School District, Canocta Unified School District, and the Lake County Office of Education began our school year. And on September 7th, Kelseyville Unified School District will begin their school year. While all of our school districts will continue to require or continue to offer independent study model of instruction, meaning that students can remain home, they can remain in the safety of their home through this pandemic, what we are seeing is over 95% of students have chosen to return to classroom-based instructional settings. But again, I do want to re-emphasize that children who cannot or choose not to receive their instruction in a classroom-based setting have options. They just need to talk to their principal and get enrolled in an independent study program. Independent study is not like it used to be in the past. Elements of distance learning are now required. So there is daily synchronous instruction required within that independent study model, particularly for our younger grade levels, and that is reduced as students get older and it moves back toward that more of an independent study, self-paced, guided practice sort of curriculum. It has been a challenge to move to the point where we can safely and transparently and deliberately open our schools. And I do want to make sure I thank our teachers and our classified staff for all of the additional work that they have had to put in preparation for opening schools in a COVID-19 year. Some of the things that we have recommended that schools implement include regular and consistent, transparent communication with their community and their staff and their parents. We have recommended the inclusion of signage on all of our campuses and being prepared to modify that signage as the situation changes. So, for example, there is no longer a requirement on school campuses to maintain that 6 foot of social distancing. So while we are still trying to engage in spacing, that 6 foot requirement isn't there, and sometimes our signage may need to change appropriately. We are supporting hand washing Not just like we traditionally have at the preschool level, where every student washes their hand before they start, as they come in each day, before they leave each day, and before each meal or snack each day, and we sing a hand washing song. We are now implementing that in the grade school level, and then we are encouraging our middle school and high school students to regularly engage in hand washing. We're reducing crowd size, so eliminating rallies and eliminating school-wide assemblies. And we are requiring staff and students who feel any illness to stay home. You know, in days past, oftentimes we would encourage people, we would look up to people who could come into work just a little sick and make it through the day, push through the day. This year, last year, that we're not in that same ballpark anymore. We are requiring any student or staff that is feeling any side of illness to utilize the flexibility to stay home. Face masks or face coverings are required in all of our schools, and that is a requirement of the California Department of Public Health. So anytime vaccinated or unvaccinated individuals are indoors, all of our schools are required to participate in face coverings. We are also recommending that those face coverings be utilized outside, and a matter of fact, 2 of our districts are requiring that face coverings be utilized outdoors as well as indoors. California Department of Public Health has also mandated vaccination or regular testing for all school staff. That includes your district office staff, your on-site staff, county office staff. So basically everybody that works in that educational setting. Our school nurses are taking up this challenge of how do we weekly test each of the individuals in our schools, our staff members in our schools who have not yet been vaccinated. LCOE, County Office of Education, has set up a team to go out and support our school districts that do not have school nurses with that testing requirement. So while LCOE also does not technically employ a school nurse, we have some health pathway classes, nursing classes in CNA and medical assisting, and I thank our teachers in those classes who have stepped up along with some of our MA graduates, our medical assistant graduates, to implement this testing program. And then we are encouraging vaccination for all students 12 and up. And I want to remind everybody that the Pfizer vaccine is now approved for everyone 16 and over. It is still authorized for emergency use for those that are 12 through 16. So, in partnership with Public Health, Lake County Office of Education has also utilized our same staff to put together a vaccination team, and we've conducted vaccination clinics in most of the high schools throughout the county, and we continue to be available at the request of school districts to engage in outreach to vaccinate our students. Now, while we are targeting students with those vaccination clinics, we are not limiting vaccination to just students. Anyone who shows up there will receive a vaccination. In terms of our facilities, the schools are continuing to sanitize on a daily basis. We continue, was implemented early last year, a fogging schedule where we have backpack foggers and go through the classrooms utilizing a botanical that's designed to neutralize viruses. The static electricity causes it to be attracted to flat surfaces. The flat surfaces are all fogged, and that neutralizes the virus that may exist in our classrooms and our office spaces. Plexiglass dividers continue to be utilized for those that wish to utilize them. Many of our schools have implemented access points to enter the campus so that all students may be screened before coming on, in addition to utilizing technology where parents are having to attest to the wellness of their children before they come to school that day. I briefly mentioned the HVAC systems, but I think it's worth mentioning that the ventilation upgrades were able to move forward at this point in time because our school districts made a commitment 4 years ago when smoke days started to impact us in Lake County. And by smoke days, I mean days when districts were unable to serve students because of unhealthy air quality. So at that time, we made a commitment as school districts to figure out a way where we can continue to serve children under the premise that our classrooms can be as safe or safer than students staying at home on a smoke day. Now, that doesn't mean that there would be a lot of outdoor activities. As a matter of fact, there'd be no outdoor activities, but our classrooms could be as safe. So we began the process of upgrading our HVAC systems to HEPA or MERV 13 or better at that time, and utilized last year to finish that process. In addition to the HVAC upgrades, all of our school districts have purchased supplemental, standalone HEPA filters that are in each of our classrooms and each of our office spaces, and they're running 24/7. So that ventilation piece is key as one of the many mitigating factors to support or to eliminate the spread of COVID in our schools. Again, I would like to thank our teachers and our classified staff for helping to implement this safe and transparent return to school. So, that's a little bit about the schools. Let's talk about the students here for a second. So under guidance from California Department of Public Health, we have shifted the way that we are working through COVID cases when we have a positive case on campus. Last year, the 2021 school year, we would have shut down the school or shut down the classroom if we had one positive case show up in that classroom. This year, there's been a shift or a change in how we're moving forward. And that shift is that instead of closing the classroom, we're isolating the student who has tested positive or staff member that has tested positive. So if a student tests positive at school or their family reports that they have tested positive, that student is to remain home from school for 10 to 14 days, and during that time, they will be enrolled in the independent study program. And remember, the independent study program for younger grades includes daily synchronous online instruction. For the middle school age students, it includes weekly synchronous online instruction. And for high schools, it's much more of the traditional independent study, self-paced model. Those students may not return until they have been asymptomatic for at least 24 hours, and a report is generated to public health regarding that positive test. We then implement contact tracing, which will bring me to the next question of, so what happens to the students if they are determined to be in close contact through that contact tracing process? And this is where it gets very, very confusing and challenging. We have developed a flow chart, I didn't bring it with me today, that we utilize within our agency and we share with our school districts as a guideline as to how to work with our close contact students. So, first of all, if the individual in close contact has been vaccinated and they remain asymptomatic, they may return to school, and they will be monitored daily for symptoms. If they develop symptoms, they will be isolated and/or we would implement a testing protocol. If the close contacts were both masked The students would also be isolated for 10 days. But districts have the option of implementing what is referred to by CDPH, California Department of Public Health, implementing what's called a modified quarantine. Under the modified quarantine, the student may stay in school if they are asymptomatic. They are required to mask at all times, including outdoors. They must undergo twice weekly testing during the 10-day quarantine period, or what would have been the quarantine period. And they may not participate in any extracurricular activities, including community activities. So not just school extracurricular activities, they would be excluded from all community activities. Now, I'm simplifying a little bit because there is a way to reduce that 10-day notice to 7 days of quarantine, but there's quite a few hurdles to jump through to get there, and I'm not really prepared to talk about how to reduce that to 7 days. Many of our school districts, because they lack the ability to enforce what a parent and a student does in the community, are not utilizing the modified quarantine process. They are taking a much more conservative stance and having students serve, that's not the word I want to use, having students isolate for that 10-day period. Now, if you are unvaccinated and not wearing a face covering during that close contact, you will isolate from school on independent study for a 14-day period. And there's no ifs, ands, or buts about that. So there are some struggles that schools are facing as we roll into this new school year. Some were to be anticipated, some are, I think, a little bit of a surprise for us. The first one is that statistically, every day, students will test positive for COVID-19 in this county. And while I'm not a doctor, and I'm not the one that is going to make the call on this, the research that has been presented to me by Department of Public Health and by our local Department of Public Health is that the spread of COVID amongst children is still primarily seen in situations outside of school, and that we're not seeing a spread within school. But because we are testing and because we are taking close observations of symptoms, many of them are found in school. Positive cases are identified in school. The concept of students testing positive scares many people. And I think what we need to do is we need to de-escalate the fear of COVID from catastrophic to really truly manageable with appropriate medical support. Because we can manage COVID and we can manage the spread of COVID by putting in place safety protocol and by making sure that we address things quickly and appropriately. Another item we're struggling with is that all of this work, all of this effort takes additional staffing. And we are facing this additional work and trying to increase the staffing at a time when both our teaching staff and our classified staff are experiencing a retirement bubble. Our workforce is a senior workforce, and they are retiring at a faster rate than we're able to sometimes fill those positions. So we're struggling to hire both classified and teaching staff at this point in time. We are seeing a growing and oftentimes or sometimes unanticipated growth in enrollment. So while I've been citing for the last 7 years Department of Finance statistics that show Lake County as being either the fastest or second fastest growing county expressed in terms of student enrollment, when we're struggling to hire, growth is a problem to deal with. Where we see unanticipated growth is because of distance learning. Many families moved to Lake County during this last school year, but never took the time to enroll their child locally because they were already engaged in an educational program through the district they were in. And you can do distance learning from a school in San Francisco while living in Lake County just as easily as you can do distance learning while enrolled in Lake County and living in Lake County. So many families chose to forego the stress of changing schools in mid-year and wait until the beginning of the school year to enroll their child locally. And the other big issue that we are struggling with is broadband infrastructure and the lack of connectivity that our students and families face, both for financial reasons, but the schools are taking care of those financial reasons this year and into the next couple of years, but the schools don't have the ability to address the infrastructure issues and the lack of connectivity in the homes across Lake County and the regions across Lake County. So, as I think I've said a couple times now, our independent study programs require synchronous online instructional activities. So we are required to somehow breach that infrastructure gap that exists with broadband. So with that, I will open this to any questions you may have.
Thank you very much for all the information you've provided, not just to us, but to the public. I think what happens in our schools is important to all of us, so this has been a great conversation so far. Opening it up for comments or questions from the board. Supervisor Pyska.
Thanks for coming here today, Brock, and thanks, we really appreciate your diligence over the last year and a half with this. Just for clarity, each district has their own set of COVID protocols that are based on the guidance from California Public Health, is that correct?
So, you know, the governmental structure of school districts is confusing. People envision that there's this hierarchical structure between the district and the county office of education, and then the county office of education and the state Department of Education. And that is not the case at all. Each school district has their own governing board, and that governing board is ultimately responsible for the operations, the day-to-day operation, or the operations of the school district, and the superintendent then becomes responsible for the day-to-day operations functioning under the direction of the board. So yes, each board may develop somewhat different protocol as long as it fits within both the local and state Department of Public Health guidance to operate under, yes.
So one of the issues that's come up this week, and we've spoken about it, is the lack of rapid tests in some of the districts or one of the districts, and potentially throughout the state and country. And so if parents are looking for a way to get their children tested, to get them back into school, or for any other reason, what's your recommendation on how they obtain a test?
You know, I should have addressed that question. Thank you for bringing that up, because just as I walked in here, I got confirmation from Rob Young, who is the Emergency Services Coordinator for the County Office of Education. And again, this is a big thank you to Lake County Public Health. They have been able to come up and fill the requests that our school districts have during this shortage of quick tests that exists throughout the state of California. For those of you who may not be aware, the supply chain has been divided in support of schools. Schools can no longer receive direct support through their local public health office for the supply of testing. They must now register directly through a partner program between California Department of Public Health and California Department of Education. And while we were in that transition process, the supply chain of, I guess I will say, there was an error in the inventory numbers that existed at the state. And so the state did not reorder all of the supplies that were needed to now implement 2 chains, logistics chains for COVID testing. So we're experiencing a delay of 4 to 6 weeks in terms of COVID tests coming down from the state. And so we are limited to what's on our shelves. And right now, local public health has helped fill that gap. So our schools should be able to test. Rob Young is driving those tests around to all of our school districts today.
Oh, that's excellent. Who is paying for those tests? Are the districts on the line individually for those tests, or how is that working?
I'll say the districts are not paying for the tests. I believe, and I can't tell you how local public health is paying for them, but I believe that the state has set aside funds to pay for those tests.
For schools?
I know through the school's supply chain, there is also no cost for the school districts.
Okay, great. So one other question about... Oh, sure.
I'm sorry,
Go
I just
ahead.
had one more thought on that. That doesn't mean there's no cost to the school district. There's still all of the costs for implementing coordination and procedures that follow, and the follow-up procedures that go along with it. So, but the tests themselves are free.
And so is parental consent required for testing on campuses of students?
Parental consent is always required for any testing of any student. So if districts are choosing to utilize that modified quarantine process, they must get parental consent before they administer the test of the student. If the student and family choose not to consent to testing, then they would just have to revert to the 10-day of quarantine.
So my last question is about siblings and families. So if we know that there's a positive case in a family, how does that affect different siblings that attend different campuses?
Well, through the contact tracing, we're able to identify if a student tests positive or is identified as being positive. That contact tracing typically would identify that all the other siblings were in at least close contact. They may not be positive, so then we would implement that close contact protocol in terms of isolation and or modified quarantine.
Okay, thank you. That's all I have.
Thank you very much for your questions. Any other comments or questions? Supervisor Simon?
Yeah, just a follow-up on kind of Jessica's, a positive test in the household. Can the whole family get a test or just the student at the school?
At the school site, only the students
Okay.
will receive tests
All right,
and staff.
all right, thank you. And then the other question I have is for the athletes that we have in school this year and the modified protocol for the quarantine. I just had a follow-up because the way you understood it is if they go on the modified, they can go back to school, they can attend school, but they can't do any extracurricular activities.
Correct.
And just drawing that line, obviously, because when they come back to school, they're still going to be in the lunchroom, obviously, right? Able to eat lunch with the other students and those types of things. So just wanted some clarity because that 10-day or 14-day, for some of the student athletes, that could be, cost them, a third of their season or something like that. If there's any opportunity, I just bring it up when you just want to understand it a little bit, being obviously a coach here in the county and understanding those protocols.
And I too was a coach, football coach, athletic director, swim coach, lacrosse coach. This is one of the unfortunate situations around COVID. And the guidance that we're following is the guidance that is put out by the California Department of Public Health. So we in education do not possess the qualifications to really change the guidance that they have put out. So in order to protect the district from liability, as well as the administrator from direct civil liability for failure to follow what has the effect of law, which is a public health order, we are recommending that districts follow the guidance that's put out by California Department of Public Health. The struggle becomes the messaging piece of this, because the messaging piece of it doesn't make sense to necessarily say your student's safe enough to come to school, but it's unsafe for them to participate in all of these extracurricular activities. So I can see that crossed messaging or that mixed messaging element to that. And I think that's one of the reasons that some of our districts have chosen to not implement the modified quarantine process and just have every student stay home from school as well as extracurricular activities for that 10-day cycle. What was I going to say? The piece of this that I think is key is that, as that kid in high school who was motivated to go to math, English, science, and social studies because I knew at the end of the day I was going to get to the weight room and then I was going to get to football practice, this is not the messaging that we want to give. But this is the messaging that we are required to put out there and we are required to implement.
And I want to thank you for answering that, Brock. My question comes from the point of understanding that these are mandates that are coming down from the California Department of Public Health, and that our local officials obviously understand, but as we are, just as a board too, there are things that come down that we have questions on and don't quite understand all the time, but we'll implement and follow those. As you said, with the liability question and others, I just wanted to ask that question, and I guess it's back on me to, as a leader in the community, to reach out to the state level, because I know we had this somewhat issue last year when there were potentially going to be sports, and I think the big controversy was whether or not there would be cheerleaders on the sidelines for the games, and I know that that was eventually changed, just at looking at some of those protocols. So anyway, I thank you for answering the question. I wanted that clarified also, that is not something that a local decision here. It came down from the state, and we've got to work through that process for our kids and our athletes to keep everybody safe. So thank you. That was my questions.
Thank you.
I just have a follow-up on this point. Is that okay? Is yours a follow-up?
No, go ahead.
Oh, so is there any differentiation with athletes and extracurricular activities if you're vaccinated or not?
Good question, and there is the ability to differentiate how you work with students who are vaccinated in terms of extracurricular activities. They may continue to participate in extracurricular activities if they were in close contact and they were vaccinated, fully vaccinated.
Good question. Thank you.
Yeah, good question for that, because actually that is not the message that Lakeport Unified is sending out. And that was part of my question, was messaging. I thank you today for coming out and giving this information to us, but I know for myself as a parent with students at the high school at Lakeport Unified, we need to do a better job at messaging. And I don't know how it is with the rest of the school districts, but this information that you've given today, I only knew some of it because I had contact with a principal or a superintendent, or I contacted a school board member to fully understand what the protocols are. And I think our school districts need to do a better job at their messaging so we can fully understand what the protocols are as a parent. So when you get that call from the school that your child had a close contact with a positive case, the school district doesn't ultimately ask you if your child is vaccinated. They're waiting for you to tell them. But if you don't know to tell them that your child is vaccinated so they can stay in school, you don't know that information. For myself, my child stayed home from school for a couple days because he had a close contact, I had no idea that the fact that if he was fully vaccinated, he could have continued to stay in school. So I think we need to do a better job at messaging in our community with our school districts.
I want to make sure I don't overstep my authority. Obviously, the school boards have the ability to make more restrictive requirements than the California Department of Public Health guidance. But the California Department of Public Health guidance does allow for vaccinated individuals to continue in their extracurricular activities.
Thank you, bro.
Supervisor Crandall?
I didn't know that.
Yes, and of course, after you said that, I think this might be part of my next question is situations where families decide they don't want to vaccinate, they want their whole family to vaccinate, or vice versa, where the family feels completely unsafe in sending their child to school because of the opposite. Are they given the opportunity to conduct an independent study? And I think you might have answered it, but I just wanted to kind of like highlight.
Yes, every family is given the opportunity to participate in independent study. They do not need a doctor's note. They do not need anything that says this child should. It's not a matter of should, it's a matter of does the family choose to participate in independent study. Now, we are required to implement re-engagement plans for those individuals that are not engaging in their instructional opportunities through independent study, but at least for that first piece of it, every child and every family has the right to request independent study and receive independent study.
Thank you for that. And with that, my question really is, how is truancy being dealt with in this situation? Or is it kind of like something where?
That is a real struggle that we are working our way through. This is probably not the time to be overly aggressive in terms of addressing truancy, but really focusing on strategies to engage attendance. And there's a difference between truancy and attendance. So Lake County has a truancy problem, and even before COVID. And when we look at our student attendance figures for our first, second, and third graders, and I always pick those grades because those grades are typically not choosing to cut school, our numbers are amongst the lowest in the state. So how do we balance that truancy problem with what is now an attendance and engagement problem because of the complications of COVID is a complex conversation that does, at this point in time, I think really has to focus on re-engaging families, re-engaging students, and in the long term, partnering with our district attorney's office to re-implement a truancy program at some point in the future.
Thank you.
Thank you, everyone. I just have one simple question. Actually, it's a two-part question. We've kind of touched on the vaccination, and I'm hoping that you can provide maybe some numbers. What is our student vaccination rate for 12 and up, if you have that? And also, what is it for our staff? And what is the strategy for future vaccination clinics? I know we've worked on the mobile vaccine clinic. Is that something that's you're a part of those conversations on getting access to those mobile clinics? Just kind of curious as to what the strategy is to make sure that it's available as much as possible.
Supervisor, that's a lot of questions in one question, so I'll try to remember them. First of all, the percentage of students that have been vaccinated is roughly 20% of students have been vaccinated. Our numbers in Lake County are lower than the statewide average, significantly lower than the statewide average. And if we look at some of our comparison counties, particularly those along the coast, where we're seeing vaccination rates of students in the 80s, 85% at this point in time. So it is obvious to us that we need to do a better job of getting our children vaccinated, our teens vaccinated at this point in time. The question around staff vaccinations, we're just wrapping up the mandate for staff vaccinations came down a couple of weeks ago. We're just wrapping up the count on that at this point in time. We're seeing a range of anywhere from, in our districts, anywhere from 70 to 80% of staff are vaccinated. So It should not be an overly burdensome process to implement testing for the remainder of the staff that have yet to vaccinate either, many of those staff are in a situation where they cannot vaccinate, and we're going to have to continue testing throughout this pandemic. The next piece of the question just slipped my mind. What was the follow-up question?
The strategies for vaccination clinics, and if you are involved with the conversations at the mobile clinic, as I think that would be really useful to be able to mobilize in specific areas where it's needed.
I'm not going to overstep and say that we're involved in every conversation that public health has. I can't address that particular piece. I know we've had conversations with public health along those lines. We are now to the point where we're back into the school year. We are seeing cases develop amongst our teen and our child population. And I think at this point in time, families may be more willing to engage in vaccination clinics. So I do believe that we as school leaders need to become more aggressive in making sure that we have clinics available for our families to access.
Thank you for that. And I know that it was brought up about the different school boards and the school districts and having their own local government for those specific students. I think that's what makes it difficult. I think throughout the state of California, already each county kind of had their own subset of rules of what you're expected to do when you cross the imaginary lines into another territory. Same thing for school districts. It makes it confusing when they're not all forced to follow one specific set of rules. They can create their own. And I think that's what makes it really confusing for proper messaging. And so it is important for each school district to make sure that their messaging is very clear to the people that they serve. But I think that's the difficulty of it all is the way that our government is set up. It really comes down to the local jurisdiction to make sure that our messaging is as strong as possible. So that is a difficulty that I think we're never going to end with. We just need to be better at it and continue to strive to be better at it. Any further comments or questions before we open it up for the public? Let's go ahead and open it up for the public. Any comments from the public on this COVID-19 update? Let's go ahead and unmute Jeremy Rarick. Sorry if I said their last name wrong. Please give us your name, and you have 3 minutes.
Oh, can you hear me now?
We sure can.
Okay, perfect. Let me start with a comment a local teacher made online. She said, "I wish parents that don't vaccinate would just have the shot put in their heads, put them out of their misery." Another teacher at Middletown Middle School said, or screamed at her student to not take a drink of water in class. So what I want to do is look at the facts, what the facts are in Lake County. Lake County, COVID's been around for 18 months. There's 65,000 residents in Lake County. There have only been 4 COVID deaths for folks under 50 years old. Only 4 in 18 months. And only 14 under 65 years old. There hasn't been a single death of any child under 18 years old, not one. But the board is pushing these children and young adults to run out and take an experimental vaccine that has been proven to cause heart inflammation, blood clots, neurological disorders, and death in that age group. World-renowned doctor and epidemiologist Dr. Peter McCullough was an advocate for the vaccine in January. He has performed countless peer-reviewed published studies over the past 30 years. When his patients started having severe side effects, he changed his view and recently said, quote, "This is far and away the most lethal, toxic biological agent ever injected into a human body in American history." I believe him, but it's not just him. Many doctors, including my own local doctor, have quietly advised me not to get the vaccine. Why would I risk it for my age group? The common flu is far deadlier than COVID for that age group. This has become a mass hysteria, and the board is spreading the spear for political gain. It's kind of disgusting what you all are doing. You have children masked in schools, even though science doesn't agree with you. A 2015 peer-reviewed study showed that not only were cloth masks ineffective, but they also increased viral transmission because of contamination. Do you think fourth graders are necessarily taking precautions to prevent contamination of their masks? Of course not. That means you are actually increasing young students' risk of viral transmission in Lake County. Another extensive peer-reviewed study out of the University of Louisville showed the same results. It concluded that masking indoor requirements had no measurable effect on COVID-19 transmission. So why do you continue to support the anti-science position of forced masking young children? You could care less about the psychological or physical damage that you are doing to our kids. For me and the hundreds of parents that I represent at Unmasked Our Kids Lake County, this shit ends today.
Thank you very much for your comments. Next, we have Darylyn. Again, if you could provide your full name, and you have 3 minutes.
I'm Darylyn Tharp. I completely agree with what Jeremy said. It's all valid and provable. But also, I would like to know, clarify this. Did you say that students that are vaccinated are not required to get tested, but students that are not vaccinated are required to get tested?
And if you can finish your comments so we can get to that answer, that way we can,
Okay, then my comment is, why would they discriminate against the people who have not been vaxxed when it's proven that the vaccine does not prevent transmission? It was not even designed to prevent transmission. So why discriminate against the non-vaxxed? Thank you.
thank you very much. Superintendent Falkenberg, if you would like to respond to that.
First of all, I'd like to indicate that it is not our local board's decision. This is California Department of Public Health mandates that we're following here. In regard to required testing, no student is ever required to test. It just changes the protocol as to how we can move forward with each student. And there, you are correct, there is a differentiation in the California Department of Public Health guidance on how to work through situations when students have been vaccinated as opposed to situations when students have not been vaccinated. So, I choose to use a different term than you do, but it is a differentiation in processes.
Thank you for that. Next, we have Julia Bono.
Hello, can the board hear me?
Yeah, if you can maybe speak a little bit louder.
Okay, I'll try. Is my video feed available?
No, but if you can provide your name and then you have 3 minutes. We don't do video feed on the Zoom.
I have an exhibit to show before the board. I've noticed that other individuals are able to show exhibits. Would it be possible, please, to
I
show
don't
my
know
exhibit?
of any other individual that's had the ability to show an exhibit on Zoom.
Yes, your advisors have showed exhibits.
Okay, this is public comment.
She's wasting.
All right, okay, so if you won't see it, I'll send it to you.
Please.
Okay, my name is, can I start my 3 minutes now?
No,
Please get started.
Okay.
sorry.
My name is Julia Bono. Although the board and its advisors seem notably in favor of promoting widespread vaccination against COVID-19 to county residents, I would like to draw the board's attention to the questionable effect of vaccines on the number of COVID-19 cases. According to data compiled by the CDC, COVID-19 cases reached their peak in early January 2021. See the graph shown in my video feed, which you're not showing. The CDC's data shows that by January 8th, over 300,000 new positive test results were being recorded daily in the United States, although by February 21st, that number had fallen dramatically by 82% to just 55,000. COVID-19 vaccinations were granted emergency use authorization in late December 2020, but just 5.9% of Americans were fully vaccinated by February 21st. Clearly, the COVID shots had virtually nothing to do with the notable decline in positive test results. The most sensible explanation for declining rates of COVID-19 therefore appears to be natural immunity arising from previous infections. Evidence for this is a study by the National Institutes of Health that suggests COVID-19 prevalence was almost 5 times higher than reported due to typically mild undiagnosed infections. I'm linking the link to you. Even the CDC notes that the available vaccines have not been that effective. It states on its website in late June, the 7-day moving average of reported cases was around 12,000. On July 7th, the 7-day moving average of cases reached over 60,000. This case rate looked more like the rate of cases we had seen before the vaccine was widely available. I've also linked that to you. Secondly, I would like to mention the value of natural immunity to COVID-19 versus vaccination with an mRNA vaccine, such as the Moderna vaccine and the Pfizer-BioNTech vaccine that recently obtained FDA approval for use in some age groups, although it remains under an EUA for those between 12 to 16 years of age. The SARS-CoV-2 virus contains 5 proteins that are recognized by the human immune system after a natural infection. But the mRNA vaccines currently available only code for one protein known as the spike protein, since it appears on the spikes that radiate from the central sphere of the virus. Since a mutation can readily occur in this spike protein, but far less readily in all 5 viral proteins, this means that natural immunity remains far superior to current mRNA vaccines. They're easily made obsolete, as we've already seen with the rise of the Delta variant that can cause COVID-19 symptoms in fully vaccinated individuals. mRNA vaccines
And
also
your 3
have
minutes
potentially
are up.
harmful
If
side
you can
effects.
please finish up.
My own sister-in-law experienced after being rushed to the emergency room with a blood clot in her heart
If
shortly
you
after
can
her
please
second
finish
Moderna
up.
shot. She is now on 4 medications and has had to resign her
Your
job.
3 minutes
Her
are
adverse
up. If you could
reaction
please
to the
finish up.
COVID-19 vaccine was reported to the CDC VAERS database by her doctors, and she remains under observation. Thank you
Matt-
for hearing me.
Thank you very much. Let's move on to phone 1113.
Yes, thank you very much. This is Dr. Will Tuttle, and I'm speaking on behalf of the children, really, and all of us here. I think the point is, the great journalist and writer Upton Sinclair summed up the situation, I think, very well. He said, the hardest thing in the world is to try to get someone to understand something when their salary depends on them not understanding it. This is the situation we're facing right now, I think, with the health director, with the supervisors, the superintendent, the media, Lake County Record B. All of your salaries depend on your not understanding the devastating impact of the policies you're implementing and the destructive fear-based narratives that you're promoting. This was true also of Dr. Swaminathan, the World Health Organization chief scientist, who claimed the same thing that Dr. Gary Pace claimed last week, nonchalantly said that ivermectin is ineffective with COVID. So fortunately in India, Big Pharma doesn't completely monopolize medicine as it does here, and there was a whole movement of tens of thousands of holistic doctors in India who knew that ivermectin is very effective and made it available to the people with great success. And so of course we hear none of this in our pharma-controlled media here, but now Dr. Swaminathan is on trial in India for deliberately misleading the Indian nation about the benefits of ivermectin, causing countless deaths and suffering, and she's actually facing the death penalty for that. So maybe now she's willing in her heart to understand something, that she was merely a puppet and a parrot for the most criminally corrupt corporations on planet Earth, and that she and the policies and statements that she was told to make were directly destroying lives. The same is true here, I think. These are not my opinions. These are really the facts of the situation. We have, if we have tribunals here eventually and the truth comes out, then perhaps people like the health director will be similarly held accountable for deliberately suppressing information about alternatives and also for deliberately refusing to investigate the devastating impacts of the vaccinations. There's something called the principle of lesser magistrates, which is the obligation that local officials have to protect the local people from tyrannical directives that come from the state and federal level. We need to be protected from them, and you're really responsible for that. So similarly, you, local government officials, could be also held criminally liable for your behavior for blatantly failing to question the pharmaceutical narrative, taking away our constitutional rights and the rights of our children, wrongly extending states of emergency, promoting the injection of deadly and harmful chemicals, and thereby contributing to the killing and injuring of people in Lake County. All of these procedures you're mandating are devastating to our health and on every level. The children have a 99.998% COVID survival rate. Their risk of death is similar to being hit by lightning. Why are you targeting them with these toxic fear and masks and so forth? So every time we have a moment of silence for someone who has died of COVID, who should we be holding accountable?
If you could finish up, please.
Okay, I just want to say our conscience is our greatest ally, and hopefully we'll use our conscience to realize that it's not justifiable to refuse to understand just because our salary depends on us not understanding. Thank you very much.
So I'm going to pause for a second. I feel like I have to say something. It saddens me that we are arguing on things that I just believe are blatant, just obviously wrong facts. They're not facts at all. They're just straight up lies that people believe. The data proves otherwise, but it's sad to me that we ignore that there was almost a 20% increase in deaths in the entire United States last year, and 400,000 people died from something before a vaccine was widely available. And yet here we are fighting over the vaccine, which, if you look at all the data, the people in the hospitals and the people who are dying in large numbers are not the people who are vaccinated. Yes, eventually when 90% of the people are vaccinated, we're going to start seeing larger numbers of people who are in the hospital that are vaccinated, but people are not going to be hurt in the same amount as what it is right now. You don't hear of refrigerator trucks for people dying from the vaccines. You hear about that at our hospitals right now that are overwhelmed. That's what's going on in the South as we speak. I'm just and Del Norte. I'm confused why we can so easily ignore 400,000 people that died in 2020 when the vaccine was not available to the public. It's kind of disgusting to just ignore that, like it didn't even happen, and those people didn't matter. And your rights aren't being taken away. You got your 3 minutes. Everybody gets their 3 minutes. You want more than 3 minutes, run for office. And nobody else is taking your rights away. Nobody is forcing you to do anything. This rhetoric is dangerously disturbing to me. And you talk about humanity, but you're ignoring the deaths of so many other humans. I find that inhuman as well. So I can't continue that rhetoric without pausing and making those statements because it's just truly disturbing. Next, phone 6478.
Very well said, Supervisor Sabathia.
Hi, can you hear me?
Yes, we can hear you. If you could please get your first and last name, and then you have 3 minutes.
Yes, my name is Madeleine Buehler, and I like to utter my concern, deep concerns about the kids who should be now vaccinated, because there is 99% of non-cases for kids. They're immune to it. And now they get all vaccinated and treated like elderly people and middle-aged people. And this is emotionally very, very heavy for them. And we just really push them into their death. So many have commit suicide and are forever sick and ill from these emotional pressures, and the little babies don't even ever see the mothers and friends' faces because of the masks. And I mean, it's such a disaster with all that lockdown, masks, and vaccinations, which aren't vaccinations, they're shots, and they're very dangerous. And I think you don't have to follow the orders of the state, because if the state tells you to jump over a cliff, you won't do it. I mean, why do we all obey to these non-science commands? I think this has to really stop, and I understand all these parents who are frightened with their kids about all these obligatory movements they do, and they disinfect with chemicals the whole school. And I mean, this has to stop. Thank you.
Thank you for your comment. Phone 2689. Please provide your name, and again, you have 3 minutes.
Can you put it on live?
Hello, this is Christina Robertson. Yes, it is very disturbing how many deaths have occurred since COVID-19 was announced due to the refusal to implement early treatment. That is our only hope forward, is implementing early treatment with drugs that have already been approved by the FDA, safe drugs. Some people may not need them, but others may. I know a person who was sent home. He went to see medical. He wasn't sick enough. They wouldn't see him, so they just sent him home. And what did he do? He went into, I believe he just went into some kind of a shutdown. He wasn't taking care of himself, drinking water. It made him tired. He slept and he went unconscious, and well, he died. They also force that they didn't know better. I don't think the hospital staff knew better at that time. They should know better by now, not to be putting people on ventilators. That's not the appropriate treatment. So that's not really what I wanted to say, but that I had to respond to. Yes, it's sad that all these people have died. We are upset about it. Don't think we're not. But it's also tragic that the people in influential positions are following orders and marching our world forward to a totalitarian government. It's really time for you to look at the world news, not just the whatever news you're looking at. Look at some of the doctors, researchers who are absolutely world class. Look at it. Look at the research that's being done. This is an enterprise. This pandemic that only global vaccination can end, this is an enterprise that will create more wealth for some and more sickness and death and poverty, economic devastation for others. So it's really time for you to stand up and kind of look at the information that's really out there and even risk your jobs. You can always file a lawsuit yourself. But this is time, really. There's too much information out there. You've got to look at it. And children should not be getting the vaccination. It has been shown that their hearts, that it causes heart damage to children. They should definitely not be getting this. And the people who are dying
Your 3 minutes are up. If you can please finish your comment.
They have comorbidities. They're elderly. All right, thank you for hearing.
Thank you very much for your comment. I see nothing further in the Zoom room. Anything from our board chambers for this agenda item? And seeing none, bringing it back. Any further comments before we close up?
Just one comment from the last speaker there, and we said we need to stand up. I truly believe. I think I've said this multiple times. I myself and I think this board are standing up and doing what we need to do. Sometimes doing the right thing is very hard and very challenging, and I come from a point, as we talked, I said I got the Moderna vaccine as soon as it was possible. I know my family did, and encouraged them to do that. They can make their own decisions, but standing up for our communities and doing the right thing is not always easy. In doing that, it always jeopardizes. Been threatened right here about a recall and other stuff on this diocese, but I truly believe that we are moving in the right direction. We are looking to push towards the right direction for humanity, and this is a pandemic that is real, whether you want to believe it or not, and we'll continue to work on that, in that direction. So when you say stand up, we're doing it. That's why you call in every week with misinformation and misguided, words over the Zoom or however you're doing it. But we are standing up, and we'll continue to do that. So just want to make that point.
Thank you very much. And I think that the point, no matter what institution we're talking about, is about keeping people safe. It's keeping kids safe. It's keeping their families safe, because kids do not just go home to a boarding school room and board. They go home. And a lot of the kids that I know are in the area of Clear Lake, they have their grandparents taking care of them. They have their uncles and aunts taking care of them. They have elderly people taking care of them. And what happens in our schools eventually comes home to our homes. And it's so much more than just one individual. It's about the community. It's about the greater good. And everything points in the direction that we are not going to be hospitalized, and we are not going to die at the rate that we've seen. And we're already seeing that decreasing. Our first surge, we had a 1.7% death rate in the county. Now, in the last 30 days, it's at 0.8%. We are reducing that because we are better protected, and we are seeing those numbers drop everywhere. It's a matter of what are we using for the protection, and is it working? And everything points to yes. And so nobody's forcing anybody to do anything, but we got to stop looking for the alternative facts that just work for what it is that our view is. We have to look at what's happening in our hospitals. We have to look at what's happening right here in our local area. And in our local area, 9 out of 10 people in our hospitals, sometimes more, are unvaccinated. And we want to protect those people. We don't want to ostracize them. We don't want to make them look like they're less of a person in our community. We want to protect them, which is why we keep talking about vaccination and helping to protect everyone that we can. It's as simple as that. We're all connected. It's not just about schools. It's about everything. Superintendent Falkenberg, thank you so much for being here. Appreciate your time. You definitely filled in the hour and then some. You reached your goal. Any last words before we go ahead and close this item up?
No, I just wanted to thank you for the opportunity to present today, and should you seek any further information in the future, we are readily available to support.
Thank you.